welcome to our NewsX podcast, which is Get Candid with Chitvan. So here with me is Dr. Ajay Sharma, is Chief Medical Director of IQ Superspecialty Hospital. Hi, Dr. Ajay. How are you?
I am fine, thank you.
So, Dr. Ajay, as we know that people are facing so much issue with the eye, especially with the eye. So, what is the problem? Like, why people are facing these issue only? Just because of the strokes?
Okay, so heat as such, these are summers, and in summers definitely the heat affects whole of the body. We are all humans, and we are acclimatized to a certain temperature, and when the temperature exceeds that limit, the whole body reacts to it, and especially the eyes. The eyes are a very soft target to everything. Even if you say you stand in front of heat, even in winters, in a fire or something, if you wear your uh, then also you feel that the fire gives you heat in the eyes. So similarly, this is heat everywhere around. So it hurts your eyes in many ways. So the cornea, the black part, what you see is the thing which is very sensitive, right? And when the heat waves or the windy goes inside, it gets dried up very soon, and that's the reason when everything starts. So people will try to blink their eyes more. Will try to close their eyes, and then the sun, direct sun, when it goes inside the eye, definitely eye is not tuned to that much amount of the light coming in, and then you will see most of the people either making some sort of a slit or taking your hand and just doing it, or wearing caps or wearing goggles. Now those are the remedies rather. So that again hits your eyes, and that can cause problem to the eyes, and there can be sunburns, there can be burn inside the eye also. Any time any particle can go inside your eye, and if that does, that can again cause problem.
So, how do these technology improve patient outcome compared to traditional methods?
Okay, so ophthalmology or eye surgery or eye treating eye patients are, it has changed a lot in past 25 to 30 years. So initially there was, I'll say, no technology. We were just operating the patients by giving good amount of cut in the eye. Say for the example, doing a cataract surgery, it was done with around 12 to 13 millimeter of incision. Now the technology which again has been developed in past 25 30 years, it has it has brought down the incision from 13 millimeter to around 2 millimeter. Now that is the technology. 13 millimeter, you give sutures in the eye, there were thick sutures, and patient would recover in 4 to 6 weeks, and then there were more chances of infections in the eye.
Yeah.
And there was again, if any patient got operated in summers and rains, the chances of infection used to go high. But now with just 2 or 2.2 millimeter of incision, the chances of infections are negligible. Secondly, the healing is very quick. We just ask the patient to be at home for 3 4 days, and after that patient can resume the normal work, and even in 7 days can go to the office. Now this is a technology for the cataract surgery. It has given such a boost. Then there are technologies which has come up in the cataract, is a femto cataract surgery, which
Yeah.
again, where everything, most of the steps of the cataract surgery are done by a true laser. Now that again does the thing in few seconds. What we manually we do in few minutes, it does in few seconds, and it is all controlled by the laser. Yes, doctor does it. Doctor has to be there, but it is very precise, very clear. And if I want to make a cut of 5 millimeter, it will be 5 millimeter, not 5.23 or 5.7 or something like that.
True.
So that is again a technology. Then in best thing is the LASIK. People maybe 25 30 years back, you won't have seen people going out
Yeah.
and say, oh, I just want to get rid of my glasses. How do I go about it? But
Exactly.
now you can walk into a eye specialist and ask, and they will tell you so many things about getting it removed by LASIK, or a femtolesic or a silk procedure, and the latest is silk what at IQ what we have. So, and if you can't even get it through that, then there are lenses which goes
Okay.
inside the eye, which we call as ICL,
Hmm.
and that's with that you can remove the glasses. So this is the technology, and it goes on in retina, which is the back of the eye, for the glaucoma, which is kala motia,
Yeah.
and oculoplasty, where people would want to have a, good eye cosmetically, big
Hmm.
eyes. Everyone says you have big eyes, and so big eyes, or they want to have a Botox, they want to have fillers and all that. Now it can be done today's world, and that is a technology.
Yeah. So my next question to you, can you explain me the treatment process for the conditions like cataracts, glaucoma, and diabetic retinopathy, basically?
Okay, so I talked about the cataract part a bit,
Yeah.
just now, but I'll
Mm.
just summarize it in a way. The cataract, the latest cataract treatment is femto cataract surgery or femto laser assisted cataract surgery.
I'm sorry, I'm interrupting you in between, but can you explain our audience a little about the explanation
Yeah,
that you're giving?
yes, I'll
Thank
just tell.
you.
So that is the now femto laser assisted cataract surgery is a surgery which is where it is done in two parts. One part is done by the femto laser. It is a true laser, and that's a machine which different companies have it, but that is the latest technology,
Yeah. Hmm.
and that machine does three four important tasks where we used to do it manually. It gives the incisions, it gives a inside, it's a CCC what we call, it gives the cut inside the lens, and then it cuts the lens into either 4 pieces, 6 pieces, 8 pieces, and liquefies it further.
Okay.
Now all we have to do post this surgery is take the patient to the next table and just suck out the liquefied lens and implant the lens inside. So major 5 steps of the surgery, three are done by the machine very precisely, very fast, and it is repeatable, and it is the very safe. And then the last 2 steps are done by us when we take the lens out. Now that too is taken out by a technology, the phacoemulsification, which again are excellent machines available. And the lenses what we are implanting again can be a monofocal lens, a bifocal lens, or a trifocal lenses. Now
Hmm.
there is a huge range of lenses where if you want, I don't want to wear glasses, it will be okay. You don't wear glasses, we'll give you a trifocal lens.
Yeah.
So that is the latest. The hospital is giving some part or some
Hmm.
charges for the cataract surgery, which are definitely much lower than what we charge from the people. But that is what a benefit for the benefit of the patient. This is something very good, and we do stitchless cataract surgery with a
No.
foldable lens in that Ayushman scheme, which is again one of the best surgeries what we are doing,
Yeah.
and that is the patient's right can get. And even
Hmm.
there, the retina surgery can be done, a glaucoma surgery can be done in the Ayushman Bharat card scheme.
Hmm.
And so let's come to the glaucoma part. Glaucoma is what we call as kala motia, which is dangerous,
Hmm.
and Safed motia or the cataract is a normal physiological change in the eye,
Yeah.
which probably everyone is going to have. But glaucoma is a disease, where in pressure inside the eye, like a blood pressure, it goes up, and when it goes up, there is a nerve inside the eye, which is the optic nerve. Now, optic nerve can take the pressure up to a certain extent, but when the pressure increases, the blood
Hmm.
supply to the optic nerve decreases, and the the optic nerve, that part of the nerve dies, and for the rays from the eyes, they cannot go to the brain, and patient can get blind. So that is, and it is a irreversible blindness. So you have to be one who has a family history of glaucoma,
Hmm.
or who feels there are headaches, continuous headaches in the eye, BP patient, hypertensive patient, diabetic patient. All these patients are more prone to glaucoma. They should go and see their doctors, especially after the age of 40. There are many treatments available.
After the age
Initially,
of 40, right?
yes,
Yeah.
after the age of 40, they should
Yeah.
go. And initially, surgery used to be the only option. They were not good medication, but now medicines, topical medicines, just putting drops can prevent a patient from going blind. There are many good drops, and I'll say around 70-75% of the patients can be treated only by the medical treatment, and if not, then there are surgical treatment where surgeries can be done.
Mm-hmm.
Now that is about the glaucoma. Glaucoma, everyone should be very cautious because this is something, if you have to get it checked with the doctor every 3 months. Like a blood pressure, you check your blood pressure, once and then morning, okay, what is my pressure? So you should go to the doctor at least once a month or twice a month to get your eye pressure done in if you are a glaucoma patient.
Mm.
Uh,
So,
Coming to the retina, you said retina diseases or diabetic diseases. So
mm-hmm.
diabetes is bad in every sense. It can affect every organ of your body, and
Okay.
especially the eye. So eye, it affects the back of your eye, which is the retina, and there it can do anything. And ultimately, if it is not treated properly, then again a diabetic patient can go blind.
Yeah.
So, but when the patient is in time, then there are many things which can be done. We can just see the patient. If there are some leakages there, we can give lasers and treat the patient. If there is some edema in the eye, then again there are certain injections where anti-VEGF injections are given, and they are very helpful, and there are very good treatments available. There are surgeries now available which we call as a surgery through a 26 gauge vitrectomy, 28 gauge vitrectomy, which is just like a needle going inside the eye, back of the eye, and no stitches are needed and everything. The surgeries are done. Now, this is the technology, the development with which the diabetic treatment can be done. But yes, along with that, if a patient is diabetic, one, he or she has to take care of the diabetes should be controlled by
Hmm.
medicines. Only then the eye part. After that, the eye part.
Okay. So, how often should people get their eye checked, and why is regular eye screening is important for people?
So a child, when the child grows after age of around 1.5 to 2 years, till the child is able to follow certain things, can see what you want to show a child, right? You
Yeah.
say, okay, look there, that is something. So that is a way when we know that yes, child can also see what you are seeing,
Okay.
right? Or so that should be tested that way. And when a child is good enough, say around 3-4 years,
Mm-hmm.
then normally all preschools or schools get a eye examination done nowadays. And in certain I think it is even advice, it is there in the law also, where school admissions need the immunization status also, but we as ophthalmologists have asked them to include the vision also, because that again is very important. So
Yeah.
there the eye vision is tested, but it can be different with the pictorial graph and something if
Mm-hmm.
the child can't read and all. So there it should be tested, and normally schools up to the age of 7, 8, 9, they get the eye test done. And if one finds there is some problem, take the child to the doctor. All those patients, again, as I said, who have a retina pathology like a diabetic patient, again should go to the doctor for the retina checkup
Yeah.
once in 4 to 6 months, right? That is
Okay.
again mandatory. And then again, whenever the doctor calls,
Mm.
okay, for a review and all, that should be done. And for again the patients like glaucoma, and as I said, they
Mm-hmm.
should be going for the regular pressure checkups for every 2 months. And there are certain other tests which are needed in glaucoma which need to be done either 6 monthly or a year, which are the field of vision, or what we see, the RFNL is, which is inside the eye. We see how the nerve looks like. Those are the ultrasonic tests and all. This is how it should be done.
Can you elaborate on the role of nutrition in maintaining eye health? And are there specific food or supplement you recommend?
Okay, so diet as such is important for everything, so
Yeah.
whether it is eye health or your general health or your gut health, or your muscle and all that. So that is very important. And there are various, I'll say, logic. Some are logic, some are myths that you eat this, you'll get this and all that. But generally, if one is eating a normal food, now normal food, I believe, I want to say, is what you cook at home, right? Not the greasy food and not the other thing, not the not the the food from the market or the street food and all that. So
Mm-hmm.
that is not a good for anything, for your body also, for your eyes also. So for but yes, eye needs very good vitamin A. You uh, always when you say कि vitamin A, आँख के लिए vitamin A चाहिए होता है, so that is something you need, and vitamin A is needed, and you get all this vitamin A, vitamin B, and all that. You get all this in green leafy vegetable, pulses,
Yeah.
yellow fruits, right? Milk, and then especially the what we call as carrot juice, that gajar ka ras.
Mm.
Whenever it is in that season, it is a pure source of vitamin A, right? And yellow fruits are like like amla, and green leafy vegetables. All these, and if someone is a non-vegetarian, then eggs and fish, because again fish has omega 3 fatty acid. All these things are there, and eggs have vitamins again. So all these things are very important for eye health, and one should consume that, because there is a even a disease where there is a deficiency of vitamin A. Then the patient, even especially in kids and younger age, the people can go blind at night, which is called night blindness.
Yes.
They can't see at night.
Hmm.
So that is because of deficiency of vitamin A and all. So that is why
Sorry,
vitamins are
because of
very
what?
important. Deficiency of vitamin A,
Okay.
right? So that इसलिए that best source of that is the carrots and the carrot juice, and the other thing which I said, green leafy vegetable, pulses, and milk products and all this. So this is the diet which for a good eye health one should be having.
So, with the increasing use of digital devices, what are the common eye problem associated with the screen time?
So most common eye problem associated with the screen time is the dry eye disease or dry eye syndrome.
Hmm.
Now, syndrome, if I mean, I like elaborate, is a mix of many symptoms and many things. It doesn't involve one eye, one part of the body. It involves different part of the body.
Of
So
course.
in dry eye syndrome, there is involvement of the eyes. There is involvement of your neck, your spine, and your back. Now that is the involvement, and at times your brain, because you get headaches and all that when you're tired.
Hmm.
Now, when you are continuously on the screen,
Yeah.
it doesn't mean that only while you're working or while you're watching TV or while you're on your phone watching reels and all that. Now, every time you're doing that, you are reducing your blinking time. When you're on the screen, you will see that your blinking reflex, what you blink, normally in a minute, a normal person will blink
Yeah.
25 to 26 times, right? And when
Hmm.
you're reading or on computer watching TV and all that, that blink is reduced to 6 to 7 times a minute. Now see, it is reduced to one-fourth time. And imagine, you just try it. Anyone can try. Keep your eyes open for some time and you'll feel that you're getting some air and you're getting discomfort. Now this is the same what happens when you're more on that, eyes get dried up, and that dryness, you will ultimately squeeze your eyes to bring tears there, and then there is a reflex tears which are given, the god has given us. There is a gland here which gives a reflex watering, and at times people tell कि ऐसे करते हैं and then गरम गरम पानी आता है. So
Hmm.
this is our tears which God has given, जो reflexly आते हैं. But that is just for certain moment, certain time, not for regular every day you do it. So
Yeah.
that is something which gives. And the second is the neck. If your posture is not good, you are doing on a computer and all that, the posture is not good, you'll get a neck pain, you'll get a back pain. So that's why we say all those who are more on table chair job with the computer, they have to have a good chair. आजकल
Hmm.
spinal chairs भी सब आती हैं, तो those chairs are needed. Then for eye, what we say is a simple thing, what is called as a rule of 20. After every 20 minutes, take a break of 20 seconds and look at a distance of 20 feet. So that is 20, 20, 20. The logic is, after 20 minutes, when you're taking a break,
Hmm.
you just take your head off your computer, look at a distance of 20 feet, means, or just look farther, how much you can look, like
So,
through a
I'm
window or
sorry,
something.
I'm cut you down in between. So we are a little out of time. I'm gonna ask you last question. So
Okay.
steps is IQ taking to raise public and people awareness basically about the eye health to preventive care.
Okay, so one of the ways is this: I'm talking to you, and through you, I'm getting to the people. But other things are we do the camps in
Okay.
various localities, whether it is rural, urban, and all that. And in all, in a month, in different centers, IQ does more than 200 camps, right? And we reach out to public in that way.
Mhm.
And secondly, those are not the camp where the eye examination is done. Those are camps where we give health talks also. We sometimes we talk about cataract, sometimes about glaucoma awareness programs and all. Then there are forums where we are visiting the big corporate houses or big companies, or even the production houses, like say for example factories like Hero and factories like Honda Motors and all those things. So we go there and we talk to the workers and we talk about the injuries. We talk about what all ailments they can get, and those are again the health talks what we are normally doing it for the patient. Then we have our own site where definitely we have various types of videos available. We have our YouTube channels where we have different types of educative videos available for different types of surgery, whether it is cataract, glaucoma, retina, and all that. Those are more of education things rather than just telling the patient about, okay, this is done, and getting the patient awareness in the various technologies. That is also important. So that is what we do through our digital system also, or sometimes you call digital marketing also, but I'll call it more of awareness program we are doing it. And then we do this for our various doctors also. There are IMA meetings where different specialty doctors are told about what is new in ophthalmology, so that at least they can refer their patient for a best technology to be utilized.
So what is your advice to the people? What they need to take care of it? Like what you gonna advise the audience?
So I think seeing the summer around, seeing the temperatures crossing 50, I think my advice will be just take care of your eyes. Go out with the sunglasses, sunshades. You don't need to buy a Ray-Ban or something. You need to buy a good where it is attested and it is approved by a certain licensee, and where you should be doing that. And secondly, don't go out in a bright sun, and don't look at the sun at all. Try to wear a cap which can give you a shade if at all you're outside. Frequent eye washes with drinking water, that is needed in summers. While you're on the laptops, remember the rule of 20. And the next thing is, if you feel there is dryness and all that, you can use your lubricants in the eyes, which can at least give you some relief. During that period, this is very important, and especially being a summer, everyone is going to dive into a swimming pool. Don't dive without using a swimming goggles. Those are very much needed because the chloroquine in the chlorine, sorry, the chlorine in the water can spoil your eyes. So that is needed again. So these are few tips. We can go on and on, but something this is one.
Thank you, Dr. Ajay, for being a part of Get Candid with Chitvan.